Hey YouTube, say hi Tanvir. So he gets a free leg treatment. He's excited. So today we're going to go over some lower extremity counterstrain points, some soft tissue, and we're going to go through it kind of bottom moving up. We also have a couple HVLA techniques. So first technique we're going to do is this soft tissue technique for the foot. All right. So let's say someone has like mid-foot pain or pain in their arch. So you can easily find, just through pressing, you can come as close as possible, just through pressing in the arch, you know, starting at this ball of the foot, moving all the way up. Any pain here?
A little bit.
A little bit. Tender? Like right under here?
Yeah, actually.
Yeah, so it's like right tender under this navicular bone here. So what you can do is you can almost like running out, like wringing out a dish rag, kind of doing this soft tissue motion, really gentle rhythmic motion here. Sometimes I'll even get my thumbs under here and just start to create some articulatory motion. But again, you're focusing on this medial arch here, like so. All right, you can even switch if you want, going this way. Here, doing all right?
Yeah.
Feels pretty good, huh?
Yeah.
So we're just wringing it out this way. Another technique some people do is kind of spreading with their thumbs, kind of spreading the plantar fascia like so. But again, for this specific technique, we're just kind of doing this wringing motion here. All right. Now for the interosseous membrane of the lower extremity, because remember we have a video where we did one in the upper extremity between the radius and ulna, you can do it between the tibia and the fibula. And the angle is like this 45-degree angle kind of going straight through this way. So it's really this myofascial release, essentially kind of above the tibialis, but trying to push towards that interosseous membrane. And so again, myofascial release, you're checking ease, bind, relationships. So ease this way, bind going this way. He's kind of got a little bit more of a bind going superiorly. So here, checking clockwise, counterclockwise. So he has got more of a bind going clockwise. If I stack those, I'm just kind of waiting for that to release. All right, and you can do that going all the way down, really from here down to the ankle. But this is kind of the main spot for that technique. Okay, so if we go to the next technique, IT band counterstrain. So this one is more of just flexion and abduction. In the book, you know, we want to find that IT band. So you have the TFL here, ASIS. TFL is just outside of that inferiorly, and then that IT band goes all the way down to the lateral knee. I'll find like a tender spot here and kind of work our way down. Is that pretty tender right there? Tender. It's all tender. In the book, Dr. Nicholas is standing with a little bit of flexion and then bringing that into abduction. I also like to sit just because I like to make my job easier and just bring the leg. Let's say, okay, we'll call this a 10, bring it out. I'm trying to feel for maybe a little bit of flexion. I can actually lower the table down to create some flexion in that leg. And then I'm gonna bring it out towards me. And then what would you say it is now if it was a 10?
Like a 1. Like
a 1? Is it really just a 1? Or are you just saying that? All right, how about now?
0.
0. We brought it into a little bit more abduction. So again, that's for the IT band, starting at the TFL, but going anywhere down to the lateral knee, okay? The biceps femoris. So this hamstring muscle, we're gonna counterstrain with a little flexion and external rotation with abduction. So again, this bicep femoris attaches to the back of the fibular head, which is right here. And you'll find that tendon just above it, if you guys can see there. It's kind of right behind the most lateral hamstring. And is that pretty tender?
Yeah.
Yeah, great. He's got a lot of counterstrain points. Good for this video. Again, it's kind of similar, so we bring it into abduction with a little bit of flexion, but this one is also a little bit of external rotation. So I'm gonna fold around that point, and then if it was a 10, what would you say it is right now?
Give it a 0.
0 in this position. So again, abduction, flexion, and a little bit, and I'm externally rotating by just turning his leg using his tibia, like so. All right, so that's for bicep femoris. That medial hamstring, again, you're coming in and you're finding that tendon just kind of on the inside of that leg. You can see this, his tendon is right here. And I'm pushing up. Let's find that tender point. Is that pretty tender? Right in here. So again, so this one, it's flexion, it's internal rotation and adduction. Okay. So if I were going to do this with him supine, I'm actually going to kick my shoe off. I'm going to bring his leg kind of on top of mine. I'm going to bring it into adduction with flexion, slight internal rotation, which is this way. Now I'm going to push. What is that now?
It says 0.
0? Oh my gosh, we're so good at this. So that's supine, okay? And it looks a little bit awkward, so it's a little bit harder to do in the book. He's actually got his leg, his other leg here, kind of flexed and like this. So whatever way, works for you, as long as he has flexion and internal rotation and you're finding that tender point. Popliteus, so perfect, he's in this position. Popliteus is essentially, popliteal fossa here. It kind of lives in this band. So this triangle here is where the popliteus is. So if we push, is that pretty tender?
Not really.
Not really. Let's come out a little bit more. Or up here.
Yeah.
Yeah, like right in here, tender. So we'll call that a 10. And then what we're doing for this is flexion and internal rotation. So again, we're doing a slight flexion here, and then internal rotation. So what would you call that now if it was a 10?
0.
A 0? Wow. So that's popliteus, okay? Now for gastroc, you have two heads of the gastrocnemius, here and here, all right? And you can check which one is more tender. So A or B? A. And I feel that's like kind of more hypertonic right through there. And so this one is just plantar flexion. We bring our leg up like this. We actually can plantar flex by controlling the calcaneus here. So you guys can see how he's pretty plantar flexed in this position. And maybe just a little fine tuning. So I have a little bit of, let's see, external rotation feels better. So how does it feel now?
Go 1.
Like a 1. Maybe we need a little bit more flexion, plantar flexion, rotation. How about now?
0.
0. There we go. So that is for the gastroc. All right. So we bring that back down. Now we have our medial ankle, aka tibialis anterior. So if you want to lie on your left side facing me, treat this right leg. So the tibialis anterior, it runs right here. You want to come and see this? So it's right here, comes all the way down, and then wraps around to the medial ankle. All right. So for this point, you can either have tenderness at A or tenderness at B. So what's more tender, A or B?
B.
B. So he's more tender on that tendon of that anterior tibialis. Now what you do is you rest this here. And again, so this one is mainly inversion and internal rotation. So if that was a 10, if I internally rotate and actually invert his ankle by adding this downward pressure, so like so, see how I invert into this tender point, and what would you call that now?
Say a 0.
0? Okay, so that's our tibialis anterior. Now if he had tenderness up at this point, it's actually kind of the same thing. It's just down here you internally rotate, and if I need more inversion, bring your foot off the edge here. So scoot your whole body down. See how his foot's nice and dangly off that edge? And if we're here, we can really get some more inversion and internal rotation. Or here, inversion, internal rotation. Now for the lateral ankle, we'll just treat this one. So for the lateral ankle, that's more the peroneus longus and brevis muscles. Brevis is deeper than the longus. The peroneus longus sits right on top. So that one is, you find his fibular head, and it's really just behind and inferior to that fibular head. So it's like this muscle going all the way down, and then it wraps around the back of that malleolus. So there's a point that could be either up high on the belly, so like right in there, or it could be, that would be peroneus longus. Peroneus brevis is a lot lower and kind of underneath that longus, so this is brevis. And then you also have Peroneus tertius, which is just in front of the fibula, but very deep into here. And then you have the Peroneus longus tendon just behind the lateral malleolus. So let's try each point. So you tell me which is the most tender. So we have point A, point B, point C, or D. Which
B.
one? B. So that was A, and then B right there.
Mm-hmm.
Is that the most tender spot right
Yeah.
here? Okay, so this is our tender point for Peroneus. This is more Peroneus brevis. Now, what we're going to do is eversion and external rotation. Okay, so again, this is the lateral foot. So we're going to position this right here. You lie on your side. So if that's the point, we evert and externally rotate, like so. So I'm kind of using this downward force into the table, but using the pillow, so I have room to work with here. So if it was a 10, what did you say it is now?
0.
0. Nice. So that is our Peroneus points, okay? So this one is similar to the gastroc. It's kind of the same thing, except his tenderness is going to be right in front of the calcaneus here in this zone. Kind of similar for, patients with plantar fasciitis. So if I push down, all right, let's find a tender spot. Is that tender? Right in here? It's ticklish, not tender. How about here, or here, or here? Yeah, right here. So that's our tender point. All right. And so what you do is you plantar flex. Again, I can have his foot on my knee, and I can really use my hand too to really plantar flex, like so. And then if it was 10, what would you call it now?
0.
0. We are on a roll. There we go. Quadratus plantae. All right, so that's that tender point, counterstrain point. Short lever HVLA for a left anterior tibia. So what that means is you have your tibia meeting the talus. Let's say if they're completely even, they're kind of matching each other. Now, if this tibia is anterior on the talus, that means it's closer to the ceiling. It's higher up, all right? This is also called a posterior talus. So it's either an anterior tibia or a posterior talus. And vice versa, you can have a posterior tibia and an anterior talus. So this technique is really meant to push this tibia back into center line over that talus, okay? So let's say I could feel, now how would I diagnose that? Well, I'd check you can feel the talus here, and if I feel, doing a little bit of dorsiflexion on both sides, that this talus, let's say, is deeper, and that he has got tenderness over the distal end of the tibia, that means, and maybe pain with dorsiflexion, this tibia might be stuck anterior with respect to the talus. So what we do is, it's pretty straightforward. You cup that calcaneus to provide a gap. So if you look through the side, you'll see I can wiggle my finger here. There's a gap there. So this creates a gap for you to thrust into, okay? Now the thrust, I have my arm straight over that distal tibia, and you can zoom up to my shoulder. See I have a straight line of force, right? Going straight down. And that thrust is just a quick, you get to that feather edge barrier here, and it's just straight down like that, okay? So again, you cup the calcaneus, get over the distal tibia, and go straight into the table. Quick thrust, okay? Now for the opposite, right, where you have a posterior tibia, or a left distal tibia that is posterior, meaning it is stuck behind that talus, right? That talus is more prominent. Let's say he has a lot of restriction in dorsiflexion. He prefers plantar flexion. So you got to do a scooping thrust to get that talus to drop more posteriorly, okay? So that if it's like this, then you're getting it to go back into place and match the tibia. So some people will do fingers interlocked. I kind of like one hand on top of the other here. And my thumbs are on the bottom of his foot. So if you want to come around and see where my thumb positioning is, it's like so. So what I do is I'm locked here, and it's kind of a pull and a scoop at the same time. All right. So it's here, and then I'm kind of pulling right into me. All right. So here, and you get a lot of tension, get to that barrier like that. Okay. So scoop. Like so. I'm actually going to do this hand on top, like that, okay? So you're dorsiflexing and scooping and trying to lift so that this talus can drop back down, okay? The His whip is traditionally done for cuneiform displacement, where there's like a cuneiform bone in the foot that drops into the arch. Some runners will say, oh, it feels like I'm stepping on a pebble here, and that it kind of feels really uncomfortable to step. So the whole goal is to use your thumbs in a whipping motion to drive that cuneiform back into the dorsal aspect or the top aspect of the foot. So again, let's find a tender spot in here. Let's say, is that pretty tender?
Yeah.
Yeah, so we found one. Now it might not be super dropped in, but we're going to treat it anyway. So I have my thumbs here. This one takes a little more finesse, but it's a whipping like so. And I'm driving my wrist into a flick when I do it, okay? So let's say I don't have his leg here, but thumbs over cross, hold the foot, then it's a whipping motion. So it's quick, all right? So as I find that point, maybe there's a little bit of a wind up, making sure he's secure on the table, right? So he doesn't go anywhere. And then it's a, find that barrier, quick whip like that, okay? So it's again, you find it, find that, you know, a little bit of that barrier, just fine tuning, straight down, all right? So I find a lot of students, it's all muscle memory. You just gotta get quick with the adjustment. A lot of people do it a little too slow and not quite enough force, but remember, it's a foot bone, so it can handle quite a bit of force, okay? Then you can line your back. So this one's an interesting one because the fifth metatarsal right here, you'll feel it on the outside of the foot. It's this bone right here. Now this one, it's more of a flick this way, and you're driving it by using your thumb and your finger to create a fulcrum, like so, all right? And so you can kind of see in the book, like the arrow motions here. So it's kind of a rotation, right? All right, so it's, this finger is right under the fifth metatarsal, and it's a quick flick, like that. Now, sometimes if I need more force, I'll use both my hands here, and I'm kind of like this. So I'm here, here, and then a quick, like that. Okay, so you're driving this fifth metatarsal kind of up and out to create some mobility here. Sometimes I'll actually frame it and do some like springing, articulatory springing here if it can't really move that well. But again, it's a flick like so. So, like that. All right, how do your feet feel?
Amazing.
You feel like a new person?